every patient brings their own face and own lips into the office that we have to actually look at and decide what would be the most appropriate measure or most appropriate treatment. When we see a patient, we ask them what do they really want to do. And some people say, I want Angelina Jolie lips, and other people say, I just want it a little bit more full. Most commonly, people want the little bit more full look, not necessarily Angelina Jolie. And we have a variety of options for that. It just depends on how long-term they want their lips to be full and how large they really want them. For a patient that wants just a little bit of fullness and doesn't want it to last very long but wants a quick enhancement, we commonly use Cosmoplast. And especially for the first-time patient who is a little nervous about how big their lips are going to be, because Cosmoplast will fade away usually within 6 to 8 weeks. And it'll be virtually gone. So someone who says, I'm a little nervous about being that full, they'll find it fade away and they won't have to worry as much. When we want someone to have a nice full lip and long-term, we'll commonly use Restylane. Restylane gives you a nice full lip and looks very, very nice and lasts a significant amount of time. The only disadvantage that I find with Restylane is that it can initially cause a lot of swelling. And so it's a give and take. You'll have a long-term effect, but you'll have a little bit of swelling. So we want to have someone that is able to plan ahead of time. When they do the procedure, they're going to have 2 or 3 days where their lips are going to be excessively full until the inflammation calms down and then their lips go down to the size that they want. The in-between product is Juvederm. Juvederm doesn't give you quite as much swelling as Restylane, but it lasts pretty close to the same amount of time as Restylane. So they don't get quite as full though, but it'll be a longer-term effect than Cosmoplast. And so that individual is someone who has an event coming up within a week or so and don't want to be too full, but want to have that longer-term effect because they know that in 3 months they have another wedding they want to do and they don't want to come back in and have another treatment.